Hi, this is Stephen, and in this video we'll discuss how to assess left ventricular dimensions. Let's start with our parasternal long axis view. So you have the left atrium that empties blood into the left ventricle, the aortic valve, the aortic root, and let's add in some of the LV muscle here. Shake this in. Got your right ventricle up here. And we want to look at the dimensions of this chamber when it is at its largest, when it is full of blood, or at end diastole. So we've got our ECG down here. You've got your P wave, your QRS, and then your T. Then you've got your P wave, and then right before the QRS starts, this is end diastole, when the chambers are at their largest. And what we do, if you look, this is the long axis of the left ventricle. We draw a line perpendicular to that long axis that goes right through the tips of the mitral leaflet. This is where we take all of our measurements. And so we measure the thickness of this wall right here, the septum. I'm going to call that S. Normal value for that would be about 1 centimeter. And then we measure this right here, the diameter of that cavity. Let's call that D. Normal value might be about 5. For males, abnormal would be anything 5.8 or higher, and for females, anything above 5.2 would be abnormal. And then down here, we've got the posterior wall. We'll call this P, and this would be about 1 centimeter. For males, anything above 1 centimeter for either the septal or posterior wall, and for females, anything above 0.9 centimeters for the septal or posterior wall would both be abnormal. So once we have these dimensions, we can look at two things. First, what is the relative thickness of the walls in relation to the cavity, and what is the overall mass of the heart? So first, the relative wall thickness. So our relative wall thickness is equal to 2 times the posterior wall divided by the diameter. In our case, that is equal to 2 times 1 divided by 5, which is equal to 0.4, which is normal. Anything less than 0.42 is normal. How about the mass? Well, for LV mass, we have the following formula. It is 0.8 times 1.04 times the sum of the diameter plus the septal wall plus the posterior wall cubed minus the diameter cubed plus 0.6. It's a bit of a long formula. Let me fill in the numbers here. So in our case, that would be equal to 0.8 times 1.04 times the diameter plus the septal plus the posterior wall. In this case, that is 7. 5 plus 1 plus 1 is 7 cubed minus 5 cubed plus 0.6. And that equals roughly 181 grams. Now we like to express this as grams per body surface area. So if we assume with a body surface area of 2 meters squared, this would become about 90 grams per meter squared, which is normal. The cutoff for males, anything above 115 would be considered abnormal, grams per meter squared. And then for females, anything above 95 grams per meter squared would be considered abnormal. So roughly you can remember the number 100. So let's scroll down a little bit and plot this out. So here, I'm going to put my relative wall thickness, again, 0.42 is the cutoff for normal relative wall thickness. And then in terms of mass, we said that roughly 100 grams per meter squared is your cutoff for normal versus abnormal mass. So the heart that we just examined, both the relative wall thickness and the mass were normal. So it would fit right in here. Normal overall size of the heart and normal wall thickness. Now, what if the overall mass is normal, less than 100, but the walls are thick? That might look something like this. The overall size of the heart is normal, but the walls are thick. And we call this concentric. Let's change the color. We call this concentric remodeling. Concentric remodeling. It's not hypertrophy, the mass is not too large, but the walls are thick. Now what if the actual mass of the heart is large? So you have a larger heart here, but the walls are not too thick. The wall thickness, relative wall thickness, is less than 0.42. Well, that we would call eccentric hypertrophy. Eccentric hypertrophy. It is hypertrophied, but it's considered eccentric hypertrophy. And finally, the one that you probably think of up front when you hear of a large heart is a heart where both the mass is large and the thickness of the walls are large. I've exaggerated a bit certainly here, but this would be considered concentric hypertrophy. Concentric hypertrophy. And then let's just add that this one here is normal. And so, just from some simple measurements made at end diastole, when the left ventricle is at its largest, we can both comment on the relative wall thickness, whether that's normal or abnormal. We can comment on the estimated mass of the left ventricle, and then we can classify the heart and say whether it's normal, concentric remodeling, concentric hypertrophy, or eccentric hypertrophy.